So we offer 3 different treatment options to tighten the vagina. So many women have problems after childbirth related to their vagina being stretched out. Common complaints are lack of sexual gratification, queefing, which is air buildup during intercourse, and a lot of times both of these problems are caused by laxity or redundancy of the vaginal sleeve. So think of the vagina like a sock or a sleeve, and if that is all stretched out and stays stretched out after childbirth, it can create problems for women. So we have a few options to help improve their sexual gratification and function during sex. Those 3 options include the DIVA. So the DIVA is a laser. It's an ablative laser, which is on a probe. So think of it like it's basically like a clear plastic dildo that is inserted into the vagina, and the DIVA laser rotates on the inside of that applicator, and it fires the laser through the applicator and creates a controlled burn to the inside of the vagina. As that heals, it tightens up and theoretically improves the overall moisture and function of the vagina. So that is what the DIVA is and how it works. Oftentimes, to achieve your desired results and improve, to achieve the outcome you're looking for, sometimes it requires 2 to 3 treatments 1 month apart. So in other words, we do a DIVA treatment, wait a month for your body to heal and tighten up, and do it again, and sometimes do it again. So it can require 2 to 3 treatments to achieve improvement. The downtime following a DIVA is short. It's usually a few days of bleeding, and after that, there's really nothing else you need to worry about. The DIVA is performed under local anesthesia in our office. We will have you squirt some numbing cream, which is in a syringe. We give you numbing cream in a syringe, and you go in the bathroom and squirt it into your vagina. We let that then sit for a little while so the inside of your vagina becomes numb. We then clean out that numbing cream with some gauze swabs, and then the DIVA applicator is inserted into your vagina, and it spins as a corkscrew and creates a controlled burn on the inside of your vagina to create to create a tightening effect of your vagina. The other option is the ThermiVa. So the ThermiVa uses a radio frequency emitting probe to essentially create the same effect. It heats up the lining of the vagina, and the radio frequency energy, which is converted to heat, then stimulates tissue change to cause tightening of the vaginal wall. So the ThermiVa treatments are usually about 30 to 45 minutes in length, and again, you generally need 3 treatments a month apart. The DIVA treatments, the actual laser treatment, is only 5 to 10 minutes. It does not take very long, so it's a faster treatment. The third option is surgical tightening of the vagina. So this is a much more predictable and aggressive approach, but basically you have to go to sleep for this. And what I do is once you're asleep, I will remove a portion of the posterior wall of your vaginal mucosa. So I remove the lining of your vagina on the posterior side. So say I remove the lining from, say, 4 o'clock to 8 o'clock. That whole lining or mucosal layer gets removed, and then I suture the muscles back together, essentially making the sleeve that is your vagina narrower, decreasing the circumference of your vaginal sleeve or cylinder using surgery, right? I remove the lining or the mucosal layer from an area of the vagina, and then I repair the muscles together, creating a tighter sleeve. And then these muscles will then scar together and heal together as the suture dissolves. And that is surgical tightening of the vagina. So if you want a more aggressive, one and done approach, surgical treatment is probably your best option. If you don't want to go under general anesthesia and you're willing to try less invasive options, then the ThermiVa or the DIVA are options as well. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.